Rabbit eye experiment aim to study the effect of different drugs on the rabbit eye. Background: drug acting on the autonomic nervous system alters the pupil size and reflex. Three effects can be seen by miotics, mydriatics, and local anesthetics. Miotics, example pilocarpine, physostigmine, cause pupil constriction miosis by contracting the circular muscles by M3 receptors. Mydriatics, example phenylephrine, ephedrine, atropine, cause pupil dilation mydriasis by contracting the radial muscles by alpha-1 receptors or paralyzing the sphincter muscles. Local anesthetics, example lignocaine, block nerve conduction and abolish the corneal reflex. Parameters observed: first is condition of conjunctiva. Normal conjunctiva is thin and clear. Changes are congestion redness are noted after drug instillation. Second is pupillary size, measured using a papillometer, a scale with a round hole size 0.5 mm to 3 mm. Third is corneal reflex, checked by touching the corneosacral junction gently with a fine cotton wisp. Absence of blinking indicates loss of reflex, local anesthesia. Fourth is light reflex, elicited by shining a light source onto the pupil. Normal responses is pupil constriction. Materials required: animal, rabbit, weight 1.5 to 2.5 kg. Drugs: miotics, pilocarpine 1 to 4%, physostigmine 1%, mydriatics, phenylephrine, ephedrine 3 to 5%, atropine 1%, anesthetics, lignocaine 4%. Instruments: papillometer, corneal reflex meter or cotton tip wisp, Caesar dropper, torchlight, rabbit restrainer. Precaution: maintain a aseptic condition while instilling drugs. Do not use discolored or expired drug solution. Perform the experiment in a dim lit room. Check for pre-existing eye conditions, example conjunctivitis, uveitis. Trim eyelashes carefully to prevent interference during observation. Procedure and methods: first, animal preparation. Wait and select a healthy rabbit. Restrain it in a rabbit box restrainer for 5 minutes to allow acclimatization. Second is control test designation. Designate one eye as the test eye and opposite eye as the control eye. Trim the eyelashes. Wash both eyes with a normal saline to clear debris. Baseline parameters: measure, record baseline values. T equal to 0 minute for light reflex, corneal reflex, pupil size and conjunctival condition for both eyes. Fourth, drug instillation. Instill 2 to 3 drops, approximately 40 to 60 microliter of the test drug into the test eye, TE only. Instill normal saline in the control eye, CE. Observation: note and record observation at 0, 5, 10, 20, 30, 60 minutes post installation. Observation table: note TE stands for test eye, drug treated. CE stands for control eye, saline treated. Symbols: plus for present, minus for absent, C for congested or red eye, N for normal. Now case example: if drug is pilocarpine, miotic agent, we are taking the time scale from 0 to 60 minutes. So light reflex and corneal reflex in test eye and control eye are positive throughout the experiment, and pupillary size in the test eye at 0 minutes it's 2.5 mm, and at 5 minutes 1.5 mm, and 10 minutes 1 mm, 20 minutes 0.5 mm, 30 minutes 0.5 mm, and again it is regaining the original size by 60 minutes 1.5 mm, and control eye is 2.5 mm throughout. Condition of conjunctiva: in test eye at 0 minutes it's normal, at 60 minutes it's normal, but in between the experiment mild congestion and congested is seen. Results and conclusion: pilocarpine causes significant constriction of pupil miosis in the test eye compared to the control eye. The light reflex and corneal reflex remain intact, while slight conjunctival congestion is observed due to localized vascular response.